Day many people have been waiting for. Medical marijuana is becoming available in New York State.
There are 20 dispensaries across the state, and 2 of those are here in Erie County. The State Department of Health says 150 doctors can legally prescribe medical marijuana. Now, despite today's launch, many patients still don't have access to the drug. They say they're still waiting for an ID card from the state. One local doctor anticipates up to 500 of his patients will be candidates for medical marijuana.
New York State did not give us any form of guidelines. So when a patient comes to me, it's going to be my opinion, my research, but no experience and no science. So that's a risk.
Medical marijuana is recognized by many national health organizations as a legitimate form of medicine, but not everyone is convinced.
Some think it could lead to other problems. News 4's Ellie Ingersoll's in the newsroom tonight with more on why people are against it.
Don and Jackie, while the state will soon be selling medical marijuana, some people say the decision to distribute it came too soon, without enough research to back the decision to prescribe it.
I personally do think it was too soon.
Ellen Morehouse works for a New York State substance abuse prevention agency. She says she thinks there are flaws to the system the state has in place for these dispensaries.
I think New York should have waited for the Food and Drug Administration to do the testing and the regulation.
She has fears about what will happen if those who do have prescriptions start relying on marijuana.
One of the most dangerous things is that somebody, for example, who's experiencing pain uses the New York medical marijuana as opposed to figuring out what's really causing the pain.
Avi Israel has different fears about medical marijuana.
What we're doing right now is a knee-jerk reaction.
Israel's son Michael took his own life after struggling with an opioid addiction. When his son first had pain, Israel says he advocated for him to be prescribed pain pills without knowing much about them.
I will not mortgage my kid's future on that. I made a mistake once. My advice is, don't do it.
He says he thinks there needs to be long-term studies looking at the benefits and risks of marijuana. And if he sees the benefits outweighing the risks, then he says his position would change.
I think that before we go and start approving medication to people, we need to get off of this fast-track approval.
20 dispensaries staffed by pharmacists will be opening around the state. There are restrictions on the forms of marijuana sold. While there can be oils, extracts, and pills, the smoking and edible types of marijuana cannot be sold, something different than some other states' laws. In the newsroom, Allie Ingersoll, News 4 at 11.